partnering with the Healthcare Association of Hawaii, as well as Mountain Pacific Quality Health. And so we have a bunch of our partners here. Thank you very much. We are using this Project Echo platform model to provide education from quality improvement leadership and implementation experts, and combining this with the opportunity for case presentations and discussion so that everyone can share experiences and practical ideas from each other through the community of learning. So you are also our partners, and we learn together. And your engagement and participation is critical to our success together. Next slide. So we commit to maintain and safeguard the confidentiality of information that is shared. So all case presentations are required to be de-identified and HIPAA compliant. And in order to create a safe learning environment, we will share, basically encourage a culture of mutual learning and encouragement. No negativity, shame, or blame, or anything like that. If you don't know it all, it's okay. We're just learning and sharing, and we'll make it up together, right? Echo Hawaii case consultations do not create or otherwise establish provider-patient relationships between any specialists or patients or cases being discussed. And this is basically a learning opportunity. Next. So this is our schedule. We started the series with Leadership Through Crisis, focusing on COVID challenges. And later on, we plan to move on to the CMS mandated focus areas. But today, our topic is interdisciplinary teamwork at the management level. And next week, we will begin our series on applying QAPI principles to COVID management. Next slide. So we started this series with the theme, these are our goals. So our immediate needs is, of course, we want to get through the pandemic together. But more than that, we're actually looking for our longer range goal, which is ultimately to have nursing homes that deliver superb care. And most importantly, also establishing a community of learning. So, these are the goals that we want all facilities to become more knowledgeable and to be able to apply leadership and QAPI principles, that we'd all be more prepared for infection control and prevention. And we achieve also the age-friendly health system goals as demonstrated by improvement in star ratings and quality measures. And Mountain Pacific is going to help assist in that data collection. Next slide. This is to note that you can get CMEs, and so you have to have registered for this in order to do that, and you also have to have completed an evaluation. So just if you haven't done so already, you need to do this right afterwards. There will be a link in the chat box afterwards to complete the evaluation. Also wanted to note that this program is approved for CME, and it's also approved for the National Association of Social Workers for One Social Work CEU. Okay, so let me see. So, and as you know, all sponsors of CME are required to execute a conflict of interest policy, and the speakers will disclose that, any apparent or any real or apparent conflicts of interest. And at this time, next slide, I don't know if Dr. Dave Polikoff or Mark or Jay Flanagan are here. Let's see, if you are, please raise your hand or pop up or something. Okay, I don't see them. Okay, so I'm gonna go ahead and then talk about the AHRQ thing. John, can we just go back to those intro slides again? Okay, anyways, so basically, there is a national, actually, yes, move on to slide 7. Yeah, it's slide 7 of the intro slides, John. Yeah, so basically we have, so the University of Massachusetts, we are collaborating with them in order to provide another ECHO opportunity, which is called the AHRQ. It's a National Nursing Home COVID Action Network. And this is just another opportunity to strengthen Hawaii's nursing homes as we manage COVID together. There will be, it's a 16-week interactive virtual community of practice. And there's going to be national curriculum regarding COVID, as well as QAPI initiatives that are delivered by IHI. It's an all teach, all learn environment. There's a mix of didactic information and case-based discussion. We share best practices, as we all do, always do in ECHO. And the bonus here and the opportunity that you have by participating is a $6,000 stipend from the Provider Relief Fund if you participate in at least 13 out of the 16 sessions, and at least 2 people from your organization need to be consistent participants. The goals for this initiative, and it's paid for nationally as well, is to keep the COVID-19 from entering the nursing homes where it has not already entered, to identify residents who have been infected early, to prevent the spread between staff, residents, and visitors, to provide safe and appropriate care for the mild and asymptomatic cases, ensure staff have knowledge, skills, and confidence to implement best practices, and to reduce social isolation. So those are the multi-pronged goals for that. And also wanted to share that we are launching that next week, next Wednesday, from 2 to 3:30. And so it's very important. If you're going to enroll, you got to enroll now or as soon as possible. So I hope that they will join us later on towards the end, if at all. And then you can ask them questions if you want to. Anyway, okay, let's go ahead and make some introductions here. Okay, so so Jill is here from Mountain Pacific, and so I'm going to have her introduce our special guest speakers today. And go ahead.
All right.
Thank you.
Thank you,
Dr. Wen.
Was
there a echo?
I can hear you.
Okay.
I feel like
there is a little bit of echo.
We heard it from you. Whoever just. Should I proceed?
Somebody probably should mute.
Okay, everybody else mute except Jill.
Okay. So thank you, Dr. Wen. It's my pleasure to introduce 2 of my Mountain Pacific colleagues, Alana Jarman and Caitlin Conway. I'm going to just read their introductions, if that's okay. Neither of these ladies have any interest to disclose, by the way. Alana is a master prepared registered nurse experienced in pediatrics, family health, triage nursing, specialty nursing in neurology, as well as ear, nose, throat, and started her nursing career with the Indian Health Services. She is a co-lead for the Mountain Pacific CMS contract working with community coalitions. She is a project lead for the Montana Trauma Informed Care Grant, working with 12 various Indian Health Service, urban Indian health, and tribal health programs throughout Montana. She is the president of Montana American Indian Women's Health Coalition and serves on the Montana Cancer Coalition Steering Committee. She serves on the national design team for the IHS Partnership to Advance Tribal Health Project. She loves to snowmobile, cook, but not clean, and likes to spend time with family and friends, whether it's virtually or hopefully soon in person. Caitlin is a chronic disease and patient family engagement senior manager at Mountain Pacific Quality Health. Caitlin is a part of the Blackfeet tribe and has resided on the Blackfeet Reservation nearly all of her life. Caitlin earned 2 master's degrees from the University of Montana in Business Administration and Public Health. She also earned her baccalaureate degree from the Arizona State University in Management and has spent a lifetime working, living, and progressing the Blackfeet Indian Reservation. Caitlin currently leads efforts to improve chronic disease, self-management, and patient family engagement across our Mountain Pacific region. She brings nearly a decade of experience supporting education and health and/or healthcare improvement in tribal and non-tribal communities. She also has facilitated active engagement and cross-sector collaboration to improve clinical care and population health. Mrs. Conway is an active participant and advocate in American Indian communities, including Vice President of Montana American Women's Health Coalition. And she didn't write this, but she also has 2 adorable little girls. So I'll turn it over. Thanks, ladies.
Wonderful. Thank you, Jill. That was a wonderful introduction. And good afternoon, everyone. It's actually evening here for Alana and I. We're both in Montana, but we're just very thankful for this opportunity to speak with you all about interdisciplinary teamwork at the management level. Next slide, please. So today we are going to be covering improving teamwork and what that looks like during this really crazy time of the pandemic, what it looks like to create a culture of change and including our top level management in that. And then lastly, having those right tools and resources at our fingertips so that we can be proactive in a very reactionary climate. Next slide, please. So we want to start off by talking about what is a team, how do we improve that teamwork, and we want to talk a little bit about team steps. Next slide, please. So team steps stands for, in case for some of you this is new, team strategies and tools to enhance performance and patient safety. So it focuses on specific skills supporting team performance principles, including things like the training, behavioral methods, human factors, and cultural change design to improve quality and patient safety. It's based on more than 30 years of research and is an evidence-based activity, and it started actually back in, I think, aviation, military, and nuclear power, and has since moved into and proven true in healthcare and other industries. So this research just really helps define what the team is and what that teamwork is, and helps us understand how we can utilize our teams to do the best in especially turbulent times such as this. Next slide, please. So before we get started, I want you to either take out a pen and paper, or you could do it on your computer. And so while you're sitting there, please write down the names or positions, it doesn't have to be the names, of people who you work with in your area or you would consider your team members. So it's anyone, contributing to successful patient care. So write down those names and positions and just have that handy as we talk through today's skills and things like that. And I want you to kind of refer back to them throughout the day. Next slide, please. So what is a team? So according to Team Steps, it's 2 or more people who interact dynamically, interdependently, and adaptively toward a common and valued goal, have specific roles or functions, and have a time-limited membership. I think this is such an amazing definition of team, and really teamwork can't occur in the absence of clearly defined team. So we have to know who's in it, what are they doing, who's doing what, who's on first type concept. And understanding that structure and how these multiple teams interact is really critical for implementation planning. And I want you to also think about, as you think about your teams, remember it's not always just, the other nurses or the other staff in the facility. It's also those patients, it's the residents, their family members. All of them play a critical role in this. And so when we talk about the roles and responsibilities and communication, think of how that is being projected and portrayed to our patients and family members as well. Next slide, please. Thanks, Lana. So it all starts with communication. Communication really is the lifeline of a well-functioning team, and it serves as the coordinating mechanism for our teamwork. Effective communication is really the vital skill for our patient safety. Research has shown that a majority of sentinel events with Joint Commission have been attributed to poor or ineffective communication. So it really is that underlying problem that we sometimes don't realize is really affecting our outcomes. So it's important to listen to staff intently, listen to their concerns and their questions, and give them time to have these. Communicate often and with purpose. Remember, as a leader or a team member, your actions will impact how others are going to respond. So if you're panicked, your residents or your staff are going to be panicked. If you're calm and purposeful, your staff will reflect that back at you. So pay attention to how you communicate. Your tone, your word choices, even your body language, all influence how that communication is perceived. Also, make sure you're sharing essential information and updates routinely. Make this communication be part of your everyday. What does our staffing look like? What are our COVID numbers? What are the COVID numbers in our community? How many positive cases? Things like that. And what is the status of PPE? And then protocols, always making sure we're talking about them often. So for our communication to really be considered complete, it needs to have all of the relevant information in it, but avoiding those unnecessary details. So there's really a fine line between having everything you need, but not too much. So making sure that you have those right things in there and you don't lead to confusion with extra things in there. And always leave time for questions and making sure that people understand what you're saying. Clarity, that's also super important. And so common terms, you know, we live in the world of alphabet soup in healthcare. So making sure we're using the right terminology for the audience. So like I said, our residents and their families, they're part of the team as well. So make sure we're using common terms or terms that they understand and giving time to make sure they, you know, they can teach that back to you. A little teach back method. If they understand, they get that across. And then using common and standard terms with our coworkers as well. So your audience is really important in our word choice. Be brief. We want to be very concise and to the point with our words. Again, back to that, not too much. And then timely. You know, right now with so much on our plates that sometimes, you know, oh, I'll go do that later. I'll go tell them that later. Making sure we're getting that time out right away. So we're not avoiding delays to update our nursing staff or update our families on the progress or things like that. Make sure it's really, we have this intended message and that there's that authenticity and it's received on their end back. So communication, a huge part of it, as we know, is that feedback loop. So making sure that we seek feedback, you know, on something that we're doing, and then use this feedback for further planning down the road and utilizing that. So communication is just very reliant on that listening and purposely and intently doing so. Next slide, please, Alana. So what makes up team performance? It's truly a combination of our knowledge, our attitude, and our skills. What we're thinking plays into our interactions with our team members and our leaders. It also influences our perception of the environment. So this plays directly in how we're feeling and how we actually are doing. So think about that. If you're unpleasant, it's going to come off it's to others. So it's really important that we try to support one another and understand these skills and these behaviors so that we can troubleshoot these gaps. You know, maybe our staff is lacking the tools and resources they need, or we need to add in some education or training, or even maybe support from other staff. So just really paying attention to all of those can really improve that team performance. Next slide, please. So here's a pretty lengthy list of common barriers that teams encounter. This list is absolutely not exhaustive. So if you can think of others I left out, absolutely speak up or add them in chat as I'm going through. But team members are going to come and go. We're really seeing that even more so now. And so changes in positions and roles can really affect our outcomes. It's important to ensure there's some sort of succession planning in place so that nothing slips through the cracks. So, you know, as those teams change, did we pick up where that person left off? Who's it going to go on to? Just really important so nothing is slipping through. I know that time is probably one of the biggest issues we're all facing right now. When we're drinking from the higher fire hose with this ever-changing demands within this unknown climate, sometimes it's hard for us to balance all that needs to be done. So just being able to prioritize and making sure, you know, I had a good analogy shared with me lately that we're all juggling all these balls. And so we need to make sure some of them are glass and some of them are plastic. So if something needs to drop, make sure it's a plastic ball and not a glass ball. So so just think of that as we juggle through the demands of our everyday work. Other issues that we're seeing is lack of sharing and lack of clarity. So it's so important that we're passing on that right information to the right people at the right time. And then lastly, I'm sure many of us are experiencing fatigue, distraction, and what seems to be an unsurmountable workload. So it's really important for us to also incorporate wellness skills into our daily life as we're helping to learn to deal with the current, past, and future traumas. Being resilient is really our beacon of hope as we are for ourselves and for our residents as we move forward. Next slide, please. So through research in our day-to-day activities, there's really a number of things that continue to prove true for high-performing teams. This includes a shared mental model. So it's important to set this tone and continue to have that clear mission and vision and come back to it often, you know. In a lot of my groups, we read that mission and vision every day. What are we here for? What are we doing? And it really helps with that. And then that helps us really hone down on our roles and responsibilities as well. It's also very important to capitalize and optimize the resources you have at hand. And if you're lacking in areas, those need to be identified so that your team can perform at its best capability. Leadership is also extremely important. I know you all know this. So this isn't always done by the clearly defined leader. Any of us could be leaders. And so any member of the team could be the leader. There's even times where, that resident is the leader in this team or the co-leader and playing a significant role. So it's just really related to that trust and that confidence that's felt and ensuring that we portray that to one another. And so knowing that you're part of a team that has your back and there to support you can get us all a lot further faster. So it's just really important to also look at our performance outcomes and manage those and change those as needed. We live in healthcare where we have to, if you're going to fail fast. So, we do those plan, do, study, act, and react and respond and change as we go. Next slide, please. So like I said, leadership is really the foundational skill of all of this. So the leader is the captain who's keeping the ship afloat and moving us forward. And our leaders, I know right now, are really feeling the weight of the world on their shoulders as we battle this unknown and fight to provide the safest environment and care for our staff and our residents. So leaders hold our team together and provide this foundation. They ensure that we have the right plans in place and that they're conveyed, reviewed, and updated. This is really facilitated through that great communication, being clear, brief, and timely, and monitoring our situations, and then fostering an environment of mutual support. Next slide, please. So when leading our teams, whether you're the actual leader or another member of the team, we really must make sure that we're doing things effectively. So in order to do this, one thing to do, or one of the main things, is identifying a common and clear goal, and then defining that plan to get it. So that includes assigning tasks and responsibilities and ensuring that people know what has been assigned to them and that they have everything they need to do that. It also includes making sure we monitor that plan, communicating and changes with our team, and monitoring that team's performance. As a leader, we also have to make sure we kind of establish those rules of engagement. These are so important. It helps our teams know how to operate and perform their roles within this environment and together. We have to facilitate this information sharing among our team members. So if we don't see that information flow happening and occurring as leaders, we need to make sure that we can encourage this and really help facilitate that happening, and then be that model of effective teamwork. So as leaders, if we model that, we're going to see that mirrored back to us as well. Next slide, please. So as we put these teams into action, there are really 4 key things that I think it's important to consider. First is always time, right? How much time is available to complete these tasks and activities? And so who has the time to do it and who doesn't, and how do we manage that? That really plays into the people. So do you have the staff available, and do those staff have the right skills and knowledge to perform those roles, or do we need to provide additional things for them either to learn them or to bring on other team members to add to that? Also, is equipment, is there the necessary equipment there, and is it working? Do we have all the PPE? Do we have all the things we need? And then information, again, always going back to that. So is all of the information been collected and reviewed, and do we have what we need? And then once you have this kind of plan in place, it's important to have some sort of strategy to share this with your team. A briefing is one way you could do this. So pull your team together and form the team, designate those roles, establish the goals, and then just encourage the team to be part of the short and the long-term planning. Other ways to share this information could be through, huddles, bringing people together for a 20-minute huddle in the morning or at the end of the day to really talk through the plans that are happening in our facilities. Next slide, please. So it's very important to also verbally recognize our staff. So remind them how important the work they're doing, help ensure they have everything they need. And we're just in this really unequivocally challenging time. So how can we support and empower one another to do our best? So before moving on to creating a culture of accountability, I just want to leave you with this famous quote. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So think about this as leaders and team members and co-workers as we move forward. So thank you, Alana, and I'd like to pass it over to you as we segue into the culture of accountability.
Great job, Caitlin. That is a perfect segue into culture of accountability. So I'm going to start here. This is the IHI model, leading a culture of safety. It's essentially a blueprint or toolkit change package to start the journey to implement a culture of safety. So although it says creating a culture of safety, the fluid and dynamic effort that it takes for a team to accomplish and sustain this is really imperative to team development. So, and I don't want to take too much time to go through each of these domains, but I want to just emphasize that that they all work in partnership with each other, and that this tool is online, it's free, it's very useful too. So IHI had done a leadership fellowship a few years back, and then in addition to some work that American College of Healthcare Executives did, ACHE, for understanding and creating competencies for leadership development. And what they summarize from lessons learned is that there's really no distinct formulation in terms of providing a clear structure for leadership styles. It's like the slide says, it's a social science. And so like unlike a profession like nursing where there's clear curriculums for students, we don't necessarily see that for leadership. But although we don't have clear developed quote unquote competencies to follow for evaluation of knowledge, skills, and abilities for leaders, there are distinct processes to utilize that have been shown to be used as effective leadership styles. And in healthcare, understanding the importance of safety and accountability are key. So where are we today? This is creating a culture of accountability. It's estimated that in most workplaces, 70 to 80% of human errors and 70 to 90% of risk behaviors go unexplained or uninvestigated and therefore unaddressed. The same issue may rise again and again and again. So why do we stop at the first or second why? Why didn't we dig deeper? So in the example that I have here, there's likely an organizational norm that contributed to patient harm. So if we just keep doing the same thing, expecting different results, it's gonna cause harm. This was a study published in the American Journal of Critical Care. And so as you look at the slide, think of your staffing. We all know that in smaller hospitals, which is we're in Montana, so a lot of hospitals that we work with are small. Staff are wearing multiple hats, playing different roles, and even if it is a larger organization, due to COVID, there's been a lot of shifting and pivoting with staffing, so you might be doing roles that you maybe aren't used to. The charge nurse may also be playing the triage nurse in the ER. And how the pandemic has changed our workflows, our staffing, and the mental impacts it has on our workforce. Now more than ever, it's important to work together as a team so we can identify those mitigation strategies to reduce harm before it happens. So this is a typical, this is not what happens in Montana, hopefully not anywhere, but grain elevator, or a silo, I guess. So when we think of all the balls in the air within our organizations, as Caitlin alluded to with the glass balls and the plastic balls, think of everything that's going on in our communities, our state, our nation. And so it's a lot for one person to juggle, or just a few people. So when we think about what a silo is, the literal and figurative definition, why is it not a good idea to silo all of your goals and objectives for your organization? If you put too much focus and resources in one area, it can burst. For example, you have staff burnout, you lose sight of another goal that's being abandoned and not monitored, then it collapses. And then also think about how you currently prioritize and focus your resources. And if you step back and look at from a high level, do you have that ability to keep progress on your organization? You might not, but it's better to do it as a team. So creating a vision for safety, it involves the following. This helps to set your benchmark progress with what your goals are and where you're at. And so if you benchmark with other organizations, not only can you see what it's like outside your four walls, but best practice sharing occurs, and then it only amplifies your efforts to improve culture of safety in your organization. When it comes to creating the vision, one size won't fit all. And why do I bring up a vision for safety and not necessarily talk about the vision for your overall organization? When we look at the environment of healthcare, think back a year ago. What does that workflow look like? It probably looks a lot different than what it does today due to the pandemic. And healthcare and just in general is one of the most volatile industries, and put another block on top of that, ever evolving changes, both from regulatory, reimbursement, and then from that evidence-based perspective. And so then that next block, our resources, our staff, if you don't have a safe, sound process in place to ensure that the blocks below the staff are secured, what happens? We all come tumbling down. And to understand the how, what, when, and where of why of those processes, you need your staff and your patients. You need each other as a team. So this is where creating an organizational culture change comes in. It really is changing an organization's culture, the way that we aren't going to skip that step and we aren't going to go and leave all the issues unaddressed. And you can see there's other domains like I showed you in that other slide, but I want to talk about the impact that just culture principles can have on your organization. So like I've mentioned before, and I know Caitlin has also mentioned it too, is it takes a team to implement anything, and it takes leadership support, and especially for just culture in your organization. It's important to do what your leadership is doing right now. It's providing basic training on what culture of safety is and teamwork, and also understand how individuals and organizations must work together, define, and set the standard to lead a just culture way. So now looking back at this picture, when we implement something or change something, remember the cause and effect of everything that we do. Think of the physical, mental, spiritual effect that the staff may have regarding it. Think of what you say and how you act. And why is this important? The mental well-being of our staff. Some of you may be familiar with the very colorful triangle here. This is Maslow's hierarchy. But for those of you who are not, let me explain here. So when we use a trauma-informed lens, we can look at these two pyramids and crosswalk it against how well our organization, our community, and our state is doing in terms of preventing or addressing trauma. Why I bring this up is because it's important to consider the mental, spiritual effects that your decisions may have on a larger scale. Think about the social determinants of health and how some populations have been suffering for hundreds of years. And their health outcome data proves that there's still health inequity, but we're still expecting the same results from populations as we do from the population who has health insurance, access to care. How about staff? We expect them to come to do their work, do their job day in, day out, and not consider social, emotional, or spiritual conflicts that they may be experiencing. So according to the American Psychological Association, when human factors and engineering psychology are applied together, better outcomes happen, and safer too. The Joint Commission released an article explaining a scenario of a Sentinel event that caused a patient's death. And with the conclusion of their review and the analysis of that devastating event, it was revealed that had that organization incorporated more human factor considerations within their improvement processes, this event could have been prevented. They also went on to say that the article that human failures cause 80 to 90% of errors. So how does the incorporation of just culture and understanding human factors improve our organizational culture? When we understand and accept our fallibility as humans and come together to identify solutions to prevent harm or failure, it's then when we can start the improvement process. These performance shaping factors, it's what makes us all the same as humans. We all have fatigue, personal issues, stress, systems, processes that we don't understand or ignore. We have external distractions. So when those performance shaping factors go in effect, what happens? We have lapses in judgment. Have any of you had this happen where you're stressed, tired, distracted, and made a bad decision because of it? I have, from responding to the wrong emails, to forgetting to close my garage door, a heated garage, mind you, during the winter, to administering the wrong medication to a patient and could have caused serious harm. So tell us, and you can definitely put in chat, or if you want to speak up, how do you engage your staff? How do you make sure you're including your patients, their families, your community's voice within your organization? So go ahead and you can use the chat function there too. And then lastly, we just wanted to provide a couple example tools and resources, and we can definitely share these with the team so that you guys can get these links, and they're all free to use. So that is all we have for you guys.
Thank you very much. Okay, if we can undo the screen share, that would be great. And then we just want to open it up for just discussion. I think this is a really great, just to set the tone and set the framework. And I think it's good to remind ourselves that we sort of knew some of these things already, but I think we have to remind ourselves every so often and help ourselves just readjust and tweak and make things better. So, and as we know, it's all theoretical until you have to apply it, right? So when the rubber meets the road, and we have been tested, I think in the last several months, all of us have been tested, and testing, under times, particularly under times of stress. And so I'd like to just open this up and for sharing and see how people feel. What are some really, sometimes when you come to these strained, stressful situations, people rise to the occasion. And I think it's important to highlight some of these stories too, to encourage each other and to perform even better than before. So yeah, I'm gonna open it up now for discussion. Are there any facilities who want to share about how their leadership has responded to stress, needing to make decisions that keep changing?
Hey, this is Ken Scott, and I work at Kula Hospital on Maui, and I'm the medical director of a couple facilities on Oahu, the Villas and Ann Pearl with Ohana Pacific Management Company. And I think in both cases, there's no doubt in my mind that the whole COVID pandemic has ultimately stressed not only the working force, but trying to figure out how to cope with how fast and how many changes are coming down the pike from the CDC and the Department of Health for the state of Hawaii, et cetera, and trying to meet all those demands have been very difficult. I think I'm very lucky in the way that both organizations for me have really pushed on two things that Caitlin talked about: communication and huddles as a way to cope with what's going on. Just one case in particular was kind of funny because a week or two ago, Dr. Apollyon, who's the medical director at Kula Hospital, she was saying, we've got a lot of our processes in place, but we really need to have some drills because it's really hard you can think through it all and put everything in place and get the whole team communicating, but until you're in the middle of it, you don't realize what you haven't thought of. And of course, before we got a drill, we in our routine testing had a positive healthcare worker, and of course that isolated a whole floor of the hospital. And then we were testing every patient, and some of the things we found out was like it was the second floor. We isolated the second floor and then realized that the E-kit for long-term care was on that floor. So how do the other floors come without being exposed? And just nuts and bolts things that we ended up having to change that we hadn't thought of in all of our preparation. But it's amazing when a team comes together and everybody's communicating how every person has a bit of the piece of the puzzle, whether it's the physicians involved or administration or your infection preventionist or whoever it is. And so it's all worked out well for us, and we just gotten stronger because of it.
Yeah, great. Thank you. Anybody else have experiences with the huddles and different ways of communicating?
I couldn't speak up. One of a previous job that I had as a nursing supervisor in a hospital, we huddled every morning before we started the day, but we would also include the doctors, the nurse practitioners in our clinic, and we did a lot of procedures within the clinic, and so it was just a good way to know, like, if there was patients coming in with very similar names, or if there was procedures going on at the same time, so the nurses knew which exam rooms, or if we were going to be short of somebody on the floor to help out. So it's a really great way to be able to bring your team together, so that you're communicating as much as you can. And if somebody's leaving at 2 o'clock that day, you all know that where they went, so you don't think that you're just out a person for the day. So huddles they work very well. And we used a whiteboard as well.
Yeah. How about team meetings and all these huddles virtually? Anybody doing these virtually? Are these working?
Hi, I'm Cody Takinaka. I'm Associate Medical Director at Kahala Nui. And Kahala Nui has, on a regular basis, even before COVID, massive virtual, I think it's on GoToMeeting. It's not a Zoom, but it's like a big grid, just like how our meeting is now, only all of the different departments for QI, falls, prevention, the antipsychotics, and antibiotic stewardship meetings. A lot of those have now evolved into kind of department heads from all of the different departments at Kahalanui, including the independent living, assisted living with memory care, and the nursing home side as well. So that across the whole campus of Kahalanui, we're all on the same page about what are the new rules for the week. How are we going to evolve our policy to meet the requirements for those new rules? And what does that new rule from CMS mean for assisted living, where it's not a black and white full-on requirement, but it does make sense to a certain extent? And how does that also affect our community for independent living? So it's good that I feel like even nursing home is a different level of care, that we're discussing these decisions together, so that across all the levels of care, everyone on campus understands how we came to those policies, and everyone has a chance to ask questions about how we affect each other in the different departments. It's massive, so it took me a while to get used to which little square belongs to which person in which department and which level of care. But it's nice to see everyone's faces as well.
Yeah. Oh, that's great. Yeah. So I guess a little broader situational awareness, not just your own little silo, right? It's everybody kind of needs to be part of that, understanding the situation. Any comments on the role of the medical director? Where does that usually come in?
So, and being a part of the UH geriatrics department is really nice to be a part of HAMDA and the whole network of medical directors, because we share resources across the board for new things coming across from CMS, AMDA, or even Department of Health. We discuss, like new tags or things that we're concerned about within our geriatrics group. And for the individual facilities where we have medical directorship, we trickle down that information with advice and updates on a regular basis. So I think it's really nice that we're a part of that network of medical directors as well. So like the information flows really quickly across our network of facilities. And at any given time within the week, I can send updates to the 3 different facilities where I have patients or medical directorship. It's also nice to be a consultant for some of the questions or things that they have to do in terms of policy updates. Because there's no such thing as a dumb question. Like, why does this regulation make sense? Or what do we do if somebody's anti-brother, sister, cousin's friend tested positive and everyone else is asymptomatic, but we happen to live in the same duplex? Really complicated questions that you can't make up or predict in policy. But we are prepared to, especially within our group, to field those, now they're pretty common questions, to help them make the best decisions for this stressful time.
Yeah, hey, this is Al Yazawa. You know, I would agree. I think COVID has involved, it's been an opportunity for medical directors to be much more involved with their facilities, especially because this is sort of a novel, virus, and information is just coming through, and you need somebody who with some medical knowledge to try to interpret some of the things that have been coming out regarding the coronavirus. So I think that's really been a good thing. But even pre-pandemic, I think at least in my facilities, they do involve the medical director in root cause analysis and things like that on major issues, as well as just our routine copy type of meetings, and using the IDT meetings for from everything from care planning to any kind of sentinel event.
Great. Yeah. Do we have any other staff, nursing administrators here who want to share anything about how they make decisions and the impact of those decisions on, I think, like you mentioned, that the mental and spiritual unintentional, right, impacts? Right, even like just communication. If things are well communicated, what does that do?
Hey, Ida, this is Ken Scott again. I'll just tell you what the latest two, I think, concerns are that we're grappling with, both from the medical directorship part of it and dealing with administration on and nursing to try to figure out. And one of them is the long-term consequences of isolating our geriatric patients for so long. We're now starting to see a lot of general decline in patients, really because of that social and interpersonal relationship that is not there, not seeing their loved ones, not being able to touch them. For the elderly population, it's great for us to do all of this high tech, seeing each other on the computers, and it does help them some. But in reality, the geriatric population is used to face and touching and hugging and things that we can't do now, and we're seeing the decline. So that's one thing that we're grappling with. And the more immediate thing is, how do we prepare for the vaccinations coming out? How are we going to vaccinate the whole house? How do we make sure that we have room for isolating patients that then develop symptoms that you don't know whether if it's truly from the vaccine or they've been exposed and they're now becoming a COVID positive patient? And how do you protect the house while you're going through that? So big issues that, it's kind of like when you tell your kids how to act in public because they've never been there before. We've never been here before, and we really don't know exactly how to work it all out. And it's a team effort that involves administration and nursing and some physician leadership as well.
Yeah, are you doing any I don't know, scenario planning and role playing kind of things as part of the team together?
We haven't gotten that far yet, but it'd probably be a good idea if we did.
Yeah, I think like Dr. Scott mentioned, we had our policies in place at Kahalanui, but we did discuss at our last coffee meeting that it's time to also start planning at least quarterly drills, like you mentioned. Okay, so a positive notification always comes like on a Friday at 4:30 or on the night shift, or when the DON's on vacation. And so does everybody on every shift in every department feel confident that they know how to follow the policy, or at the very least where to find it or who to call if they don't know? We even went so far as to discuss with the facilities department about like, okay, we broke down our COVID unit already in order to use the rooms, and now what would it take to set it up again ourselves? Do we have the right equipment? Can we practice with junk bed sheets or something, just so they can go through the process of it? And also, you know, like talking about the social emotional impact on your staff and patients, to also kind of help the staff in the facility, whether they're clinical or not, feel confident and safe that we can do everything safely, even if we do have a little bit of a crisis mode when we do end up having positive patients again.
Yeah, Alana, I really like that grid that you had about team in action, and making sure the leadership has to make sure they have everything they need. You know, that one where you have to have the time, the people, the equipment, and information, and having structures for all of those. You know, so like you were mentioning, like, you know, having the drills in place. There's a structure that is set there. You know, policies and procedures are another set structure. Another one is setting those meetings that happen, those huddles, right? It's another structure that's implemented as part of communication. And having the equipment in place is a structure that needs to be there, right? And knowing where the equipment is and how to access the equipment and the e-kits and the other, you know, PPEs. They aren't locked somewhere that somebody doesn't have the key, you know, which happens as well when you least expect it. So yeah, I like the thought about being mindful of that, but it sounds like also needing to work with the entire team to adapt each and every single one of these structures to be in place.
Yeah, very good point. And I remember having a conversation with a former colleague, and she went on for her master's in social work, but we were having a conversation about trauma. And she said she had read something where a lot of people think that in order to get people's trust, you need to show them you're competent, when it's actually the other way around. You have to have their trust first in order to prove your competency. And so I think in terms of, you know, when we are going through this together, putting those things in place, showing that you really do care, that you really want their feedback, that it does take a team to understand where the gaps are, what we need to do, best practices, you know, just really facilitating that conversation and communication among the team. Yeah.
Yeah. So what do some of our facilities do to foster that trust? Anybody want to share?
I think those huddles are really instrumental in for the team seeing and being able to have access to leaders on a daily basis to hear, you know, what their plan is, what they're doing. You know, and it's okay. Like you said, Dr. Scott, is we aren't going to have all the plans. We're, you know, there's a lot of people are still kind of trying to figure this out, and we're still working on it. But I think being able to be open and transparent and communicate that for sure.
Right.
And like Cody said, there are no dumb questions. And I think making sure we have an environment where it feels safe. You can ask anything. This is unprecedented time. So, you know, ask away, and making sure they feel safe to ask, I think is really helpful as well.
Yeah. And making sure we get everybody's input, not just one-sided, right? Okay. Do we have other thoughts from other providers?
Oh, this is Frank Lemus.
Yes. Hi, Frank.
Hi. Something I do, other than the huddles, is I just, every day I'm at the facility, I go into the social worker office, I go into the DON office, and usually to the administrator office, and just kind of check in and let them know I'm here, any drama, anything exciting going on. And I think that really helps kind of engender like that sort of, team kind of atmosphere. They're also worried that I'm, overworked and too busy and bouncing between facilities and so on, that they don't want to, schedule a meeting or whatever. So it helps them know that, I'm there and they can easily, ask quick questions at that time. So I found that to be helpful.
Yeah. Yeah. Being present and approachable goes a long way, right? Just checking in, right? Just checking in. Open door policy. Great. Has that saved you a number of times?
I think so. I think a lot of times if I don't do those kind of frequent check-ins, things kind of simmer until they're at a point at which it's kind of more dramatic or harder to manage. So if we kind of stabilize those things early, just so that, family knows what's going on or whatever the case may be from kind of an early point, then it definitely saves kind of drama when everything comes to a head. So I guess I can't necessarily think of one huge example, but I think it's just a lot of little wins that we have that are just based on everyone being on the same page, from the get-go.
Relief to know that somebody else has got your back and you're not going into the fight alone, right? So everything is mutually supportive. So that's really fantastic. Yeah. So I'm noticing that we actually are at the top of the hour. I just want to close out and remind you that in order to get your CMEs, you need to click onto that link that Michaela is going to post up. And if any of your friends or colleagues at your facilities missed this session, it is recorded. They can certainly just click on and listen to the recording on their own as well. And then you can actually have a discussion if you want amongst your team and think about ways you can improve your leadership strategies with each other. And next month, we're going to be starting to talk about QAPI and applying it to COVID management. We will have Joya Dow. Some of you know her. She's a nurse, and she's actually doing a lot of infection control right now. And she's going to talk about understanding root cause analysis and identifying outbreak contributors beyond contact tracing. So we hope to see you then. And please invite some of your other friends to join and share their experiences and questions. Yeah, and also just a reminder that please sign up for the ECHO National Nursing Home COVID Action Network. If you can, it's an opportunity to get more mentorship, more and resources for this continued battle we're in right now. So thank you very much for joining us, and yeah, please let us know any topics you think might be helpful or other ways we can change things. We are always open to feedback. Thank you. And thank you for everybody who's shared. I think it was really valuable to hear everybody's experiences. Thank you.